I'm a nurse practitioner. I work in pediatric otolaryngology, or pediatric otorhinolaryngology, which is a fancy word for pediatric ear, nose, and throat. It could be something as simple as ear infections or obstructive sleep apnea, all the way up to airway, voice, and swallowing concerns. And so it's kind of an area where a lot of dynamic processes come together that really affect not just ability to live, but quality of life. I treat anywhere from premature babies all the way to 18, but also actually in adults who have congenital issues. We follow those patients later on into adult life as well. I was a pediatric operating room nurse for 7 years prior to becoming a nurse practitioner, so I worked regularly with our pediatric ENT physicians, performing procedures and interventions. Some of the things we do, even as simple as placing ear tubes, they can have an effect on hearing, which can have an effect on speech. And so when you've sent a kid for ear tubes and they come back and the parents say, "Oh, his words have exploded. It's just amazing. We're so happy." That's like life-changing for us as well as the patient. So I have a really strong surgical procedural background. And now I'm a nurse practitioner, which is all the clinical side. One thing that nurse practitioners often have more of is time. So I have time to kind of walk the person through pre-procedure, procedure, after the procedure, some education on how to take care of whatever intervention they had done, and really spend a lot of time, face-to-face time with the patient and the child, and go over all those concerns. Basically, every second I'm not at work, I'm trying to spend time with my wife and my 7-year-old and my 4-year-old, who of course are my favorite people in the world. I definitely bring being a father into being a provider. It is the classic statement that I do treat every child like they're my own, and that's one of the reasons that I am so thorough and will constantly keep pushing until we get to the result we want.